Hey, it's Dr. Atasha, and if you're a Christian, at some point you have probably heard somebody tell you that you cannot be anxious, and if you are, you should go ahead and pray about it. Well, I will agree that prayer can be really helpful, but this video is to talk about how meds, therapy, and faith can all be used when someone is experiencing anxiety or trauma. And I really want you to be able to tap in and learn some good things here that you can use for yourself or for a friend. Hope you enjoy the video. Leave a comment down below to let me know what you think. So the last part that I'll talk about today before we jump into questions and answers, and I'm looking forward to having an engaging conversation with you all, is we're going to talk about treating anxiety and trauma with faith, meds, and therapy. So as I said, I've said it again because I really do believe this: faith, medication, and therapy, all three can be incredibly helpful for the wellness of people of faith, of Christians, when we're thinking about our mental well-being. So how exactly does our faith help us? So as I've mentioned before, faith can be both protective and also helpful in recovery. So studies show, for instance, that with anxiety and depression, sometimes it can be protective for Christians, especially when you have a positive regard of how you look at your faith with God, that it can be protective for depression and anxiety. But also if you do happen to experience it, because you're a human being who has a brain that might not work as well as you want it to all the time, that your faith can be helpful in the recovery process. But in addition to that, there are things that we can do. We can strengthen our spiritual health. I started this talk off by, differentiating out mental health versus spiritual health. But I also said that they are very uniquely integrated and interconnected. So the more that we can strengthen ourselves spiritually, the better we put ourselves to be in a space where our mental health can be strong as well. So when you're building connection with God, connecting with people, you're connecting with nature, you're understanding your sense of self and your sense of purpose. That could be by reading the Bible, going to church, having discussions with your church leaders, getting involved in ministry. All of that can help your spiritual health, help you to be spiritually healthy, which in turn can help your mental health by helping you with your thoughts to be more positive, helping your emotions to be more easily regulated, or even helping your behaviors to be in line with the things that are of God and things that you genuinely will want to do. So that's one of the ways that we can address our mental health when we're dealing with trauma or anxiety or depression, is by leaning on our faith. So here's some scripture, and I wanted to just kind of throw in some verses, but truthfully speaking, there's so many, I kind of just stopped because I was like, I could just put like the whole Bible here on this slide. But, Psalms in particular, the Psalms are so beautiful because David himself, when he wrote so many of these songs, was experiencing challenges. He was being chased when some people were trying to kill him. He was feeling so guilty and remorseful for when he had sinned with Bathsheba. So there are just all of these aspects of the Psalms that are so connected to the experiences that we have on a day-to-day basis if we're experiencing anxiety and trauma or depression or any other just simple life challenge. The couple of verses that I picked here, Psalms 34:17-18. These are King James Version. So the righteous cry, and the Lord heareth, and delivereth them out of all their troubles. The Lord is nigh unto them that are broken of heart, or of a broken heart, and saveth such as be of a contrite spirit. So this is just basically saying those who are heartbroken, whether it be because of mental illness or because life is just hard, God is there. He is there with you. He will deliver you out of your troubles. And having verses like this can just be so reassuring in the moment to remember that life jacket that is always there with us, God being with us in all times, whether it is in good, whether it is in bad, is there. And it is a reminder of that to us. Psalms 118:6, the Lord is on my side. I will not fear. What can man do unto me? And sometimes people kind of counter this verse and say, man can do a lot. Man, people around us can bother you. They can be irritating. They can be disrespectful. But at the end of the day, God's glory will always shine forth because God is on our side. Thus we can aim in the best of our abilities not to fear. And if that fear does occur, because again, we're humans with brains and neurons that connect in ways that might not always touch together in the way we want them to, we then have medication and therapy that can be helpful as well. So I encourage you, honestly, the whole Bible has so many different spaces. The Psalms just kind of, I feel like every verse in the Psalm can be reassuring and reminds us of the way that God can be just so ever present, ever powerful, ever comforting for us in our lives. Medication. So for me, I'm a psychiatrist or a psychiatrist in training. I'm about a year and a half out from being able to be fully licensed. But in my training, the medication aspect of things is a huge part of what I work with people on. Because, you know, there are a lot of people who do go through Christian counseling they are praying, they are reading their Bibles, and you know what? They're like, Dr. Jordan, I am still anxious. I am still struggling with this trauma that I've experienced. Please offer some additional support. And there's medication. So a lot of times antidepressants, named so, honestly, we probably should change the names nowadays, the SSRI class. So just to throw out some names in case you may have heard of these, but we can have medications like Zoloft, Prozac, Lexapro. These are things that people take very regularly, the same way you might take insulin or metformin for your diabetes. You might take lisinopril, you might take or you might take metoprolol for high blood pressure. The same way that you take medications to help with your physical ailments, they are medications that exist to help with your mental ailments as well, even anxiety and PTSD. So as you see here, these medications classes can be used for those types of conditions as well. Therapy. So in my training to become a psychiatrist, I'm also learning how to do therapy. And what I have found to be so beautiful is that there are so many different kinds of therapy. And here I just list a few. So there's supportive psychotherapy, there's cognitive behavioral therapy, family therapy. All of these different kinds of therapies ultimately at the end of the day aim to help you to be able to really understand your experiences better and come out of it at the end living the life that you want based on the conversations and the discoveries and the work that you do with your therapist. Some alternative strategies that exist, you know, in addition to prayer and all these other things, you know, exercise, meditation, massages, guided relaxation, herbal remedies. These are things, you know, they don't have the same level of rigor in terms of the clinical studies as, let's say, the medications or even psychotherapy, but there are studies on them and they find them to be helpful. So I would say if you're involved in any of these kinds of therapies, let your doctor know. If you're seeing a doctor, just be aware that the studies aren't as rigorous, but there's a lot of help that can be found from teas, acupuncture, exercise, when it comes to our overall well-being. And one of the other things I wanted to give some practical insights, because sometimes the behavior part of the cognitive triangle can be what is easiest for us without professional training to be able to really just kind of do these things on our own to help improve and influence our mental well-being. So sleep. Get good sleep. I am learning at some point, I think I used to get like 6 hours of sleep a night and could function with that. No more. I need 9, a solid 9 hours of sleep. I wake up ready to go. I don't need caffeine. I feel happier. I'm less irritable. Getting sleep is such an important part of your mental wellness journey, because in that time that you're sleeping, your brain is resting. Our brain works 24/7, but we give it a time to rest, to really just regroup and allow us to kind of take the next day in stride. Exercise can be incredibly helpful. Having a healthy diet that provides the right amount of nutrients and vitamins to the brain, again, all important when we're thinking about mental wellness. Having positive social supports around you. So for instance, this beautiful, beautiful, beautiful virtual space that we're in with over 200 people who love Jesus and like care about mental wellness, allow people to pour into you and you pour into others as well. That can just really help with the mental well-being. Leaning into your faith practices. So studying the Bible, praying, worshiping, these are all things that can be helpful for your mental well-being. Something I have to bring up, because we like in the church, we like to pretend that people in the church not drinking, not smoking, not doing these things, and trust and believe people are doing it. And what I want to talk about is this is not to shame anybody. This is not to create stigma, because at the end of the day, my work is to meet people where they're at. I want to make sure that when we're thinking about mental wellness, avoiding things like alcohol and other drugs, even cigarettes, marijuana. You know, nowadays it's like we're working towards legalizing marijuana everywhere, but we know that marijuana can, especially when there are high levels of THC in your marijuana, can worsen your anxiety, can worsen paranoia, can worsen all of these things in your mental experiences, and people aren't talking about these. And lastly, if you need professional help, seek it. I want to encourage you that seeing a professional, I love when I see, especially when I see Black older people come into my clinic, that you are taking and prioritizing your mental well-being and recognizing that seeking help is a sign of strength and not a sign of weakness. So I encourage you, these are just some of the things that you can do to promote your own mental well-being. So in summary, before we hop into the chat portion of this, I just want to emphasize a few points. Mental illness is common and it impacts Christians and non-Christians alike. And what I'll say, it is okay to have a mental illness. It is okay not to feel okay, but it's not okay to do that by yourself. I think it's really important for faith leaders to educate themselves about mental illness. I mentioned that faith leaders in ministry, pastors of churches are the people that your church congregants are more likely to come to you when they are experiencing psychological distress. So you need to be able to recognize when something is above your training as a spiritual guide and refer people out to therapy, to psychiatry services. I want to emphasize that spiritual health and mental health are interconnected, but they are different. And anxiety and trauma in particular, they manifest in physical, emotional, behavioral, and cognitive symptoms, as we've talked about. And then lastly, anxiety and trauma are common, and thankfully, they can be treated with faith, medication, and therapy.
Hey, quick commercial break to remind you that if you're enjoying what you're seeing so far and all that you're learning, go ahead and like, subscribe, hit that notification bell so you don't miss out on any of the other videos that I post. All right, back to the content.
Some resources I'll add on and share with you. I want to make sure that we are aware of the Substance Abuse and Mental Health Services Administration. This is a space you can go to for even more information, samhsa.gov, about mental illness. They have lots of great fact sheets there. The National Suicide Prevention Lifeline, I encourage everyone to save this number into their phones, especially if you're a ministry leader. Have this number in your phone because you never know when someone comes to you and says, I feel so sad that I am having thoughts to end my life. And you need to be able to know how to react in that moment. Allow that person to seek emergency care, and the suicide prevention hotline is a way that can help direct you in that. So that number that I would love for you all to save is 800-273-8255. To save that number, because you never know when you can save a life because you have this number saved in your phone. Another really great resource, especially if you are the family member or loved one of someone who experiences mental illness, the National Alliance on Mental Illness, NAMI, NAMI.org is a place where you can go to find lots of really great information. And they also have great support groups for people who are families of those with mental illness, where you can learn about the experience, get support from others who have gone through similar situations. Some other things I wanted to share, there's a podcast that I'm aware of by a Christian psychologist. Her name is Dr. Anita Phillips. You may have heard of her. Her podcast is called In the Light, and she talks a lot. Actually, I think the first episode starts off talking about trauma and dealing with it from a Christian perspective. If you're looking for care, so whether that be a psychiatrist or a psychologist, these websites that I have here, psychologytoday.com and betterhelp.com, are websites. I have no affiliation with them. I just have found that they have been the most helpful for my patients and being able to find psychiatric and psychological care. The last couple of things, I love being able to be in touch with people. So if you would like to reach out to me, social media is a really great way to do that. As a millennial, I love social media, but I know many of you might not be on social media. But if you are, my handle on Twitter and Instagram is @Atasha Jordan. Email is another really great way to reach out to me, admin@atashajordan.com, and my website, which is going to be undergoing a revamp soon, but my website is another place to just get more information. I should probably add on here my YouTube. I have a YouTube page as well where recordings of some of my talks are there, so you can learn about other topics related to Christian mental health. Just search for Dr. Atasha Jordan on YouTube and my page should come up. But these are things that I just want to share with you all. Lastly, I have sweaters that I sell. I think it's so important for us to think about the fact that for mental wellness, Jesus and therapy together, it's a winning combination. So you can either take a picture on your phone of this QR code, it'll direct you to the website where you can purchase this crew neck just in time for the fall and winter weather. You can also just search on teespring.com, Jesus plus therapy. And lastly, as I said before, I'm just so grateful. I think the word of mouth within the Brethren Assembly is beautiful. I think my grandmother knew about this talk before my own mother knew about this talk, because word of mouth is so great within the church. So if you would love for me to be able to join for your church or even for your company, a place that you work at, I speak for corporate events as well. I would love to. So feel free to reach out to me, admin@atashajordan.com. And I think we're gonna turn off the recording so that when we go to question and answer, we can allow everyone to just really be as open, honest, vulnerable as possible. And I'll end by just saying, I truly, truly, truly pray that this information has blessed someone, that the words that I spoke today were truly just able to touch you and reach you in the space that you are, and to provide whatever sort of restoration that you are seeking in this phase of life when we're thinking about our mental well-being. So let's get down to some time to chat.
Hey, it's so good to see that you've made it to the end of this video. Thank you so much for watching. If you've enjoyed it, please share with someone. And I think that you're gonna like this video right here because it's gonna help you to learn more about the topic you just watched. Have a good one.